My name is Dr. Miriah Plawer. I started practicing as an OBGYN physician in 2008. I provide the full range of obstetrics and gynecology care. I take care of pregnant women and deliver babies. I also provide gynecology care starting in the teenage years and continue through into the postmenopausal years. In my role as an OBGYN, I am fortunate to have the opportunity to take care of multiple generations of women within the same family. I love getting to know the mothers, daughters, sisters, aunts, grandmothers, and cousins. It allows me an amazing glimpse into their lives with one another. Whenever I see a new patient in her 70s and she tells me that she was referred to me by her granddaughter, it makes my day. It's these relationships that I develop with my patients and their families that make my job so special. Not just in the births of their children, but also to hear about those children as they grow up, to listen to the struggles in my patients' lives, to listen as they share their losses. To me, it's a great privilege to be invited into the lives of so many incredible individuals and their families. I was initially drawn to OBGYN as a specialty because delivering babies is a lot of fun. When I started medical school, I hadn't yet decided to be an OBGYN. However, once I had an opportunity to do prenatal visits at a local community health center, and I was allowed to listen to the baby's heartbeat with the Doppler and measure the growth of the uterus with the tape measure, I was completely hooked. The combination of caring for pregnant women, delivering babies, and providing gynecologic care to women keeps me excited to come to work every day. It is the diversity in women's healthcare across the entire adult lifespan that keeps me constantly interested and engaged. The thing that motivates me each day is the opportunity to educate and empower my patients. Whether it is discussing the options for contraception with a young patient or the various treatment options for menopausal symptoms, I believe educating my patients is the key, giving them the information they need to make the decision that is best for them. My favorite patient experience is a fairly common one. It's the patient who has never seen a gynecologist before and sees me for their first visit. They're nervous. They've heard horror stories about pelvic exams and pap smears. We start by talking. I explain all the different parts of the exam before I start, and I give them a chance to ask questions. And almost always, at the end of the visit, they tell me, "Well, that wasn't nearly as bad as I thought it was going to be." Oftentimes, my patient's main concern can be distilled down to, is this normal? Am I normal? The best thing I can do is to listen to them and reassure them. I think listening is the most important thing in the practice of medicine. Listening to what my patient is saying and how they are saying it. Everything else follows from that. And I often use my sense of humor to put patients at ease and make them feel more comfortable. I want them to feel heard and understood. This allows me to provide my patients with the highest quality and most personalized care possible. A career in medicine can be very challenging at times, but it is the patient relationships I have built and the future relationships that I hope to develop that make it so fulfilling for me.